Hello, my name is Nina Espinoza, and I will be outlining the best practices for PTSD. There was a study conducted that surveyed several providers and experts in PTSD, and this study found that a majority of the providers endorsed a phase-based approach as a first line of treatment for PTSD. And a phase-based approach consists of three phases. The first phase is safety and stability, and that is building trust with the provider, getting the client a sense of safety and stability within themselves and their symptoms. Phase two is when they start to address the memories they have of their traumatic experience and also the meaning that they attribute to those memories. Phase three after that is integration, integrating what they have learned, their new skills and their new understanding, integrating it into their daily life and promoting a sense of well-being. Now, there are two types of interventions. There is the trauma-focused intervention as well as the emotion-focused intervention. In the trauma-focused intervention, these are methods that directly attack the trauma, the memories, and the experience. For example, prolonged exposure. This consists of either imaginal, and that is where the patient is imagining the situation and reliving it. And then in vivo is in real life when they come into contact with situations that may trigger them. So that is what is addressed in prolonged exposure therapy. Narrative therapy is when they are giving a detailed and emotional account of their traumatic experience and reliving it just to see it from all sides to get a deeper understanding of the situation. Cognitive reprocessing is another one that focuses on the thoughts, the memories, the mindset, and it seeks to reframe the negative thoughts that person associates with their traumatic events. And then eye movement desensitization and bilateral stimulation are two methods where the person is focused on the traumatic event, they're focused on that situation, and they're doing something physically with alternating sides of their bodies, either their eyes or just their bodies all together. And this is a trauma-focused way of treating PTSD. Emotion-focused interventions are focused on emotion, focused on dealing with the present moment. And so one method is trauma education, and this method has been found to be very effective in engaging patients as far as just educating them on the effects of trauma, on the type of trauma they experienced, and just having that information helps them to get a better understanding to go face their symptoms. Also, emotional regulation, teaching emotional regulation skills and different activities as far as journaling and things like that to help them regulate their emotions and their triggers. And of course, anxiety and stress management is a very effective way to cope with PTSD, as well as present-centered therapy, which is not focusing on the trauma, reliving the trauma, or anything like that, but more so focused on them in the present, how to, again, regulate their emotions and how to manage their symptoms. Many providers will all endorse the importance of using both of these forms of treatment as far as emotion focused and trauma focused. It's important to use a balanced combination of all of these practices to be effective in treating PTSD. Thank you.